Walker's aim of the paper was to review the current evidence of biological and psychosocial hazards within developing countries and to understand the impact and risk factors the environment would have on the children's developing brain. The author has identified the risk factors for specific health outcomes that are prioritised as urgent, including stunting, inadequate cognitive stimulation, iodine deficiency, and iron deficiency anemia. The key terms we're focusing on is stunting, iodine deficiency, iron deficiency anemia, and cognitive impairment. Others included under biological and psychosocial. The core determinants of health within the paper included financial and social position, physical environments, health services, healthy child development, and social environments. Stunting was addressed as a biological risk for childhood development. Stunting was caused from inadequate nutrition, with the prevalence of 31% of children under the age of 5 in the developing countries having growth retardation. The main social disparities noted within the paper was from the poverty. Due to the poverty, the children are unable to have adequate access to dietary intake. Stunting risk factors could also be associated with poor nutritional and health education and choices, the ability to access healthcare needs and services, and lack of community health support. Poor cognitive stimulation was addressed as a psychosocial risk factors. Cognitive stimulation is addressed by the children's readiness for school based on children's performance with cognitive ability, social emotional competence, and sensor motor development. Social disparities would include low socio-economic status, lack of access to educational techniques, toys, facilities, which would provide less stimulation support during the crucial development years. Issues would include a lack of community access to programs or existence of programs, ability to afford the programs, or lack of understanding from the parents of the need for interventions and the need for stimulating materials. Iodine deficiency and iron deficiency anemia was established by the authors as a need for urgent intervention. These biological risk factors in child development are identified as risk factors in the development and mental and motor performance. It is clear that child development is reduced from deficiencies. There's evidence the need for prevention is the global priority, but the low socioeconomic society of the developing countries will lead to difficulties in undertaking prevention programs. Educational programs and early detection initiatives will help reduce the prevalence of deficiency in the long term. The health inequalities is evident throughout the research paper. Walker describes that poorly developed children are likely to remain in poverty as adults, thus continuing the pathways shown for their offspring. Poverty sets up financial and social status. The risk factors from socio-economic conditions are high. Iodine deficiency and iron deficiency anemia was well established amongst the developed countries. Multiple study groups' findings consistently resulted of lower short-term and long-term development delays. This was confirmed in a 1994 meta-analysis of 18 studies, concluded that IQ score points averaged 13.5 points lower compared to the non-deficiency children. A similar report in China concluded that IQ averages were 12.5 points lower compared to the iodine sufficiency areas. The research paper addresses the poor prevalence in cognitive stimulation provided by the parents, such as inadequate stimulating materials and activities. It was documented in the research paper that increases with cognitive and social-emotional is significant in the development of children. In Brazil, where mothers are taught to make toys and engage in activities to promote childhood development over a duration of 18 months, there was a 9.4 improvement in mental skills and an 8.2 improvement in motor skills, based on the Bailey scale of infant development. The conditions in which these children are born, grow, live, develop, and age are beyond their control, but these forces are shaping the individuals in severe disadvantages. The key terms are affecting 20 to 25% of children in the developing countries. Walker and the authors have noticed the need for integrated intervention strategies for the multiple risk factors within the socio-economic environment. Based on the research findings, the aim is to reduce child development issues in a preventative approach. Action needs to be undertaken to the existing knowledge from this research paper. Programs could include standardised screening and regular routine checkups. The health professionals would benefit from a health service based in the communities to help reduce the difficulties in accessing the healthcare. Addressing access and healthcare availability will be the main focus. Understanding community requirements will help prevent development delays. Policies can be reduced to set quality standards and ensuring continued development for the future. Educational programs will benefit from maternal mothers. Subjects could include dietary advice, up-to-date information regarding the current health risks, and provide encouragement and self-awareness and healthcare autonomy. The way that healthcare is promoted needs to be addressed. Additional educators could include preschool teachers, community and religious leaders. Healthcare advice and support shouldn't just be isolated information coming from the healthcare professionals. Information ideally should be community-based, encouraging health literacy and informing the parents on healthy decision-making skills.